সুপ্রিয় দর্শক শুভ সকাল। বৈশাখী টেলিভিশন স্টুডিও থেকে সবাইকে আমন্ত্রণ জানাচ্ছি বৈশাখী টেলিভিশনের রেগুলার স্বাস্থ্য বিষয়ক অনুষ্ঠান সরাসরি ডাক্তারের আজকের পর্বে। দর্শক, আপনারা জানেন যে এই অনুষ্ঠানটিতে আমরা নানা ধরনের রোগ নিয়ে কথা বলি, বিভিন্ন বিশেষজ্ঞ চিকিৎসকদেরকে নিয়ে আসি এবং আপনাদেরকে সেই আলোকে সমাধান দেওয়ার চেষ্টা করি। দর্শক, আজকে একটু ভিন্নভাবে আমরা অনুষ্ঠানটি সাজিয়েছি। সম্প্রতি বাংলাদেশ ভ্রমণে এসেছেন আমেরিকান ডেন্টাল অ্যাসোসিয়েশনের প্রেসিডেন্ট, যিনি প্রথম এশিয়ান প্রেসিডেন্ট ডক্টর চ্যাদ গেহানি। তিনি বাংলাদেশে ভ্রমণে আসাতে আমরা এই অনুষ্ঠানটি একটু ভিন্নভাবে সাজিয়েছি। তাকে আজকে আমাদের অতিথি হিসাবে নিয়ে এসেছি। তাই এই অনুষ্ঠানটি গতানুগতিক ধারার বাইরে একটু অন্য ভাষায় আমরা পুরো ডিসকাশনটা করার চেষ্টা করব। কিন্তু দর্শক, আপনারা আপনাদের মতামত যেগুলো আছে সেগুলো আমাদেরকে যে ধারাবাহিকভাবে আমরা যেভাবে করে থাকি সেভাবে আপনারা আমাদের সাথে স্ক্রলে দেখানো নাম্বারে যোগাযোগ করতে পারবেন। এবং আমাদের সাথে আরও একজন অতিথি আজকে আছেন, যিনি বাংলাদেশের অত্যন্ত স্বনামধন্য একজন ডেন্টাল সার্জন, যাকে আপনারাও সবাই চেনেন, ডাক্তার সৈয়দ তামিজুল হাসান রতন স্যার। দর্শক, বিশেষজ্ঞ অতিথিদের কাছে আপনাদেরকে আমি নিয়ে যাচ্ছি। স্যার, হ্যালো স্যার, ওয়েলকাম টু বাংলাদেশ and welcome to Boishaki Television and welcome to my show.
Thank you, and I bring greetings to you from 164,000 member dentists of the American Dental Association.
Yes, sir. I'm blessed, and when I heard that you were coming to my show, it blew my mind. And now I am as happy as Larry to see you here today. Actually, really, sir. Thank you for coming here. And here, let's move on to our another guest. We have our another guest, Dr. Soyed Tamijul Hasan Rator. He is the very challenging pioneer dental surgeon. Everybody knows about you, sir. Welcome to my show again, sir.
Very good morning. Assalamu alaikum. Thank you very much.
Actually, I want to move to Dr. চ্যাদ Gihani. Actually, I'm Dr. Jannatul Ferdus, your today's host. Is going to talk about the international standard of dentistry today. Sir, you are the first Asian president of American Dental Association, and I am, as an Asian, I'm very grateful and I'm very proud of you, and many congratulations to you, sir. But I know this journey was not so easy. It was a very tough journey for you. Have struggled a lot. Please tell me a short story from that tough journey for our viewers, for our dentists. I think the new dentist and the young dentist will be more inspired by your space.
First of all, let me say something about my home, the United States of America. Anything is possible in the United States of America if you work hard and if you honestly believe in what you do and you continue doing what you are doing. I am not an extraordinary man. I did exactly what God asked me to do. I was born in India, and I traveled to United States when I was 24 years old, and like any other regular American in United States, I just worked hard and did the right things for our patients, our community, and our public. In United States, we do not discriminate against where you were born or what language you speak or where you come from. And by the American Dental Association electing me as their president is a perfect example of proving that anything is possible in the United States of America. So I do thank my members of the ADA for electing me.
So I agree with you, and I want to move to our another guest, Dr. Soyed Tamijul Hasan Raton, sir. As you are from Bangladesh, and you are, I think you are a very happy to lucky person, and I think you are a very smiling face and common face in our country. And you are practicing in Bangladesh for more than 30 years. That's a very long time. And Bangladesh dentistry is developed a lot. You know it better than me, and it's developing day by day. Then what the organization or what the work you want to mention now in this show for this development of this dentistry profession and dentistry education and dental treatment?
Thank you, Dr. Bristy. It's a very important question. How the dentist has developed in Bangladesh. it has some background about this. When I started my journey in 1982, that's now it's near about 38 years. There is no system of any seminar, symposium, nothing else. But I was the member, only member, still I am the member, only one member of American Dental Association.
You were the only one member.
American
So you
Dental
were the first
Association
member.
since 1986, and Professor Gihani, he is known to me since 1986.
It was a
And
long
he
time
taught-
relationship.
Yeah, long time. And he is the famous clinical professor of endodontics, that's called root canal treatment. He taught me and several times, and what I have learned from him, and I render my service to the people of Bangladesh. After that, day by day, dentistry has developed in our country, and continuous and education course have started. Our organization that is called BADI, Bangladesh Academy of Dentistry International. It's absolutely academic organization, non-political, and through this yearly we are 4-5 programs, zonal program we do, and one international program we try to do it on 30 and 31st, 10th Dental Congress. The BADI, the age is
Okay.
10 years, and started by Jahangir Kabir and Moinjan, Secretary Moinjan. And under that, we were the advisor. Now I am the vice president of that organization. Our respected Professor Moti Mullah is the president. He is a very active and dynamic professor.
Okay.
And we have a strong academic team. We have a strong academic team, though they are in academic, but for every year they prepare the program, and this program is going to be held on Intercontinental Hotel 30 and 31st.
I think our guest has come to attend that program. I want to know something about your feelings that you are attending this type of 10th International Congress organized by BADI, and what is the motive? What is the actually the target for here? To come here for this seminar to our country people, to our patients?
Sure. Let me go back to what Dr. Ratan mentioned about his membership of the American Dental Association. I want to congratulate you for being a continuous international member of the American Dental Association. That membership category was created by the American Dental Association to promote uniformity of the dental services throughout the globe. We believe that every citizen of the globe should have the equal oral health attention globally, regardless of where they were born and whether they are rich, poor or middle class. They should have the same standards of care. And how do we promote the same standards of care? We encourage and we congratulate people like yourself in becoming a member at a very reduced cost of less than $100 a year. In that you get the scientific journals, you get continuing dental education programs, and you are pretty much similar. You are bringing up the standards in your own home country. So we salute you for this. The reason for I am here today again is the same thing. When Dr. Ratan and the trustees of the body came to San Francisco at the annual meeting of the American Dental Association, first of all, I was very thrilled to receive a delegation of 10 members of body in the American Dental Association, and you travel long distances. So thank you. And when they personally invited me, I did not need any papers at that time. And I just I just called my staff member at the ADA and asked them to block those 4 days for me to travel to Bangladesh to share the common knowledge. It's always learning and teaching both together. So I'm not here just for teaching something, or my wife, Professor Gihani, who's here for teaching the orthodontics. It's not just the teaching part, but at the same time, we learn a lot from being here in Dhaka. So it's a mutual understanding, and we appreciate your friendship.
Exchange of knowledge.
Actually, sharing of knowledge also, I think.
Absolutely.
Sir, I would like to ask you this time a question that is, I think it's very important. People are waiting for this answer, and I like to mention that topic also, that how will you differ the treatment procedure, the treatment standard, like the developed countries like Bangladesh and the developing country like Bangladesh and the developed countries like USA? Has there any difference, or what do you think?
Well, teeth are teeth, and people are people. So the attitude of people towards the dental treatment may occasionally differ from culture to culture. Other than that, we believe in prevention. The prevention is a lot better than the cure or treatment. So in America, we train our patients, and we are trained to do preventive procedures a lot. And in the case where there is a tooth loss, then we go for more advanced or different types of treatment. So we believe more into the prevention rather than cure. We also promote fluorides. We also promote water fluoridation because by drinking the fluoride water, you reduce the incidence of tooth decay, and majority of the children or many of the children suffer from tooth decay, and because they have cavities in their mouth, they either don't go to school, or their grades in the school fall down, or occasionally they will be losing the front teeth. So then they start having speech problems, they can have psychological problems. And we all know that the oral cavity is connected with the rest of the body. So the good general health begins with good oral health.
Okay, oral health is important.
Absolutely.
Of course, oral health is the most important thing. Sir, I just like to ask you about American Dental Association. What's the purpose they are working for, and how the people or how the dentists of Bangladesh will be benefited by this organization?
Sure. The American Dental Association is for twofold. Number one is for public protection.
Okay.
We believe in evidence-based practice. We believe in science and technology, and we believe in advancement of dentistry for the protection of the public. That's our essential goal. When let's say lots of Bangladeshi dentists are international members of the American Dental Association, they will be continuously kept informed.
Sorry for interruption, sir. Again, we have a caller right now.
Sure, absolutely. Go ahead, Ms. Caller.
আসসালামু আলাইকুম দর্শক, কে আছেন আমাদের সাথে, নাম বলে কি জানতে চান বলুন।
আমি চট্টগ্রাম থেকে বলছি, শামীম।
জি, শুনতে পাচ্ছি দর্শক।
হ্যাঁ, আমার দাঁত থেকে 8 থেকে 10 দিন রক্ত বেরিয়েছিল।
আচ্ছা,
আমার এক পরিচিত আপু ডেন্টালে পড়ে, ওনার সাথে কথা বলছি যে আপু আমার দাঁত থেকে দাঁতের গোড়া থেকে রক্ত পড়ে, আমি কি করব? উনি বলেন যে এটা ভিটামিন সি এর সমস্যা। তো আমি ভিটামিন সি জাতীয় কিছু ফলমূল খেলাম কিছুদিন, এখন বেরোয় না বা কম বেরোয় হালকা।
ট্রিটমেন্টটা চাচ্ছেন?
আসসালামু আলাইকুম।
ওয়ালাইকুম সালাম। দর্শক, ধন্যবাদ আপনাকে ফোন করার জন্য। স্যার, যদিও আমাদের আজকের টপিকের
সাথে তার the individual problem of the tooth, it's a gum problem, but it's not the deficiency of vitamin C.
And
It's
bleeding
absolutely
from gum
infection from the
problem.
gum. So she has to what to do? She has to go to the clinic and do one X-ray, and we have to see there is a periodontal problem or gingivitis problem. It's a bone support. And just she can do one thing: it's a deep curettage, and as well as if needs the root canal treatment and cap. So it's the individual problem of that gum.
Okay.
Not of
Then vitamin C will be the,
vitamin C is
precaution, but not the treatment.
vitamin C. If she used to take the vitamin C, it will affect the kidney. It is
Okay.
storage in the kidney. So she doesn't take any.
দর্শক আশা করি বুঝতে পেরেছেন যে ভিটামিন সিটা আসলে প্রিকশন হিসেবে আপনি আগে থেকে আপনার হেলথকে ভালো রাখার জন্য, কিন্তু এখন যেহেতু প্রবলেম শুরু হয়ে গেছে, একজন ডেন্টিস্টের পরামর্শ অনুযায়ী গামটা দেখিয়ে নিয়ে আপনার ট্রিটমেন্ট করতে হবে আর এইভাবে ভালো থাকতে হবে। দর্শক আমাদের সাথেই থাকবেন। স্যার, অ্যাকচুয়ালি নাও উই মুভ টু দ্য অ্যানাদার টপিক, দ্যাট ইজ দ্য ডেন্টিস্ট্রি। হাউ হোয়াট ইজ দ্য মেইন থিং পিপল হ্যাভ টু ডু অর পিপল নিড টু ডু to keep their oral health, good oral health, as you are the pioneer of this of this sector?
The perfect example I can give you is I was not able to respond to your caller in Bengali, so please forgive me for not being able to answer the caller. But I can tell you something. What she described to me, I was saying to myself, had she gone to the dentist on a regular basis, and had she brushed her teeth at least twice a day, we prefer 3 times a day, but at least twice a day, early in the morning and then just before going to sleep. People forget to brush their teeth before they go to sleep. That's when you are leaving some of your food particles, especially in Bangladesh here, and I'm half Bengali. I love mishti. I love mishti. So when I have plenty of that mishti to eat, I'm leaving that some of the mishti between the teeth, and if I didn't brush it, the bacteria are going to start working with the sugar, saliva, and they're going to cause cavity. They are also going to cause plaque. In her case, it appears that she had a plaque formation, like a thin layer of bacteria on the teeth, and that became more into the calculus, like a hard rock. So in her case, it appears like she has more of a rock, like a calculus under her gum.
Okay.
So her treatment perhaps would be going to the dentist, having a visual examination, followed by one X-ray, and maybe some little cleaning.
Yeah, clean.
And
I
that
told you.
perhaps will solve the problem,
Yeah.
rather than what she's thinking, that her bleeding gums are for a deficiency of vitamin C, which theoretically can be possible, but it is very rare for somebody to have a severe vitamin C deficiency, not have any other symptoms, but just have the bleeding gums. So if I had to guess, which I would not, I would prefer to see the patient in my chair.
Okay.
That's where the American Dental Association comes in front. We always believe that the dentist should be at the center of care,
Okay.
because
Yes,
the
that's why I
dentist
told to
is
come to the
trained.
clinic, and so
Of
I'm
course,
able to
and
love
it's a
someone.
practical treatment. It's
Yes.
a practical thing. You have to see all the problems and then have
Yes.
need to solve the problems. And sir, one thing I want to mention, as I have searched a lot in Google about you, and you said about your wife so many times, and she is a very inspiring lady. I want to congratulate also her that she show you the rope and for this wonderful or crowning success here. So what do you think, sir, as a lady? I want to know that thing.
Well, when I went to the school, when I arrived in United States back in 1975, there used to be very few women dentists in the class. If there were like 10 women dentists in a class of 100, that used to be a lot. Now we have like 52 women dentists in a class of 100 dental students. So absolutely the woman power in dental profession has increased. Our executive director, by the way, of the American Dental Association is a very smart woman dentist who is very thorough in her knowledge. Of course, myself and my wife, we are life partners. I call her my partner first, then my wife, and then the mother of our 3 children. I'm very proud of our 3 children. 2 of them decided to follow my wife's background, which is my wife is an orthodontist.
Okay.
That means they put the wires in the teeth to straighten the teeth. And 2 of my children followed their mom, and 1 did not follow both of us and became a medical doctor. So Almighty Allah has
Of
been
course.
very generous and very kind to us.
So you are a very successful doctor, family, and inspiring personality for all of us and all of the dentists, all of the young dentists, upcoming dentists, I think, sir. Sir, I want to move to you to I like to discuss with you about the some organization in Bangladesh, and we have a national organization also, and others organization. What is the present condition, or what do you want to say about the present condition of Bangladesh about dentistry?
Thank you. Our education system was the 4 years dentistry, and other national organization is the Bangladesh Dental Society. The Dental Society, they have struggled a lot of way, and we have achieved a 5 years course.
So we
It's
have a very short time.
This is society president Dr. Qasim and Secretary General Humayun Kabir Bulbul. They are very dynamic. They are doing the progress for dentistry in Bangladesh. As well, Badi is the only academic organization. They are doing, they are trying to develop the continuation education
so
course
many
in
years.
Bangladesh. So I request all the dentists to be registered for this dental
for this
congress.
congress.
So they will gain lot of things, exchange of knowledge. More than 25 dentists, international speakers are coming for
Sir,
attending this.
the program brought to an end, sir. Really, you both are very fascinating personality, and I am very grateful to have you here in this show. Thank you once again, sir.
Thank you.
Thank
And
you.
hope for the best for the 10th best
Yeah.
Congress of
Bangladesh
that is
Academy.
organized by Badi. Thank you, sir. দর্শক, এই ছিল আমাদের আজকের আলোচনা। আগামী পর্বে আবারও গতানুগতিক ধারায় নতুন কোনো অতিথি নিয়ে বিশেষজ্ঞ চিকিৎসকের সাথে আবারও আমি ডাক্তার জান্নাতুল ফেরদৌস বৃষ্টি আপনাদের জন্য হাজির হব। ততক্ষণ পর্যন্ত সবাই ভালো থাকবেন, সুস্থ থাকবেন, আর অবশ্যই বৈশাখী টেলিভিশনের সাথেই থাকবেন। আল্লাহ হাফেজ।